Good evening, sir. How are you?
I'm fine. I'm doing fine.
Can we meet you, sir?
My name is Dr. Mimi Apoki.
Dr. Mimi Apoki. That makes you my son.
Yeah.
Yeah. You're my eldest son,
Yep.
and you are the assistant head of the family,
Practically speaking, yeah.
practically speaking. Where are we?
And we're in Munster in North Rhine-Westphalia in Germany.
In Germany.
Yeah.
Um, what do you do here?
I'm a trauma and orthopedic surgeon.
That's interesting. Trauma and orthopedic surgeon.
Yeah.
And you are married here?
Here I'm married.
You have a daughter?
I have a daughter.
And I came to do Omugwo.
Yeah.
How many years have you been in Europe?
Since 2007.
2007.
Yeah.
That makes it 18 years.
Yeah.
You've been here for 18 years.
Yeah.
Because you know the reason I'm asking you this question? Some people will think that I sent you people here because of a depressed economy.
Not really.
You know, you had always dreamed to live in Europe.
Yeah.
From what age did you make up that?
Secondary school. I think early secondary school. I always wanted something different. I think the education system and I saw in Europe and in US was what I wished for, and that's why I worked myself towards that area.
So you are a long-term thinker
Yeah.
and a strategic thinker.
I believe that in as much as your dreams might look impossible and um, to actualize, the first thing you can do or the first thing you should do is start working towards your dream, no matter how impossible it looks like. Just walk towards it. Just walk towards it, and to surprise you that you actually reach there.
Your mom used to say that the best way to start is to start,
Is to start.
and it is only what is started that is finished.
Yeah.
You are the most gentle person in the house.
Yeah.
Eh?
Yeah.
When people hear that you are my son, what do they tell you?
I think most times most people are surprised because of character difference. Most people expect me to be. Most people, even when I meet some colleagues of mine, and they get surprised that so you are Dr. Apoki's son. We didn't know, and so they expect me to be more like you, or
How am I?
I think more outspoken, jovial. They expect the charisma from you, and so most people get surprised.
And you are totally different from me. Totally different from me.
Yeah.
Totally different from me. And I'm very proud of that. I look for trouble a lot. They find trouble, Abi.
A little bit.
A little bit. No, I don't fit do you anything again. You're a German citizen here, no be so?
Yeah.
You have more authority than me here. I don't fit do you. I look for trouble, no be so?
A little bit. A little bit.
I know they care, no be so?
No.
Eh?
No.
When I came to Bucharest and I was preaching, you Constanta,
Yeah.
you were worried I was talking to Igbo when here.
A little bit scared. Yeah, harassing them a little bit.
I saw you. You were gnashing your teeth. You were scared that I was talking to Igbo like that.
Yeah.
Boss to Igbo, who born Igbo? Dr. Apoki, I don't care. Boss to Igbo. So, I don't know if I've seen you fight with any person once. Have you ever stood to exchange blows with any person
No.
in your life?
No.
Oh,
I can't remember any.
you can't remember. You're a perfect gentleman. I wish I was like you, but if I be like you, the whole family know if you quiet now. it is I be like you, not don't reach with this. So. But it's good that you as the head of the family because eventually the headship of the family will come to you, that you are a calm person. Yeah,
Yeah.
yeah, you're a very calm person. Now, how do people react? How do the Germans react when they find out that you are the doctor they are waiting for?
Uh, the concept of most Europeans when it comes to black people is from the media and everything that people hear. The idea of a black man in Europe is the idea of somebody who comes to look for opportunities, somebody who is begging, somebody who wants to, somebody who they need to help.
Mm.
And most of the time, I might even go when I was working in the hospital. I walk past the patients and nobody will greet me. But when I come out with my work coat and rest, and people are surprised. Even most of the time, I hear. Sometimes I meet people and I tell them. They ask me what do I do, and I say I'm a doctor. They will run and call their wife. Are you really serious? They don't believe it. They don't believe it. They don't. They they get very surprised.
Particularly with your age.
Yeah, with my age, I think the first hospital I was working in, the place I usually go somewhere to buy food, and he thought I was a student. And most of the time, even after coming to meet the patient, after operating on the patient, they ask me when is the doctor coming. Now
And you operated on
I
them.
operated on the patient.
It's interesting. It's like when I started practice early too.
Yeah.
I was 26, 27. I was running a 40-bed hospital,
Mm.
and then they will say they are looking for the doctor. I'll tell them, sit down and wait, let me go and call him. Then I will enter the office. Then when they come in, they will be shocked that I'm the doctor. So God has helped us. We started life very early.
Yeah, that's true.
You started your medical career. You entered secondary school at the age of 9,
Yeah.
and we most of us in our family, we have done things quite early. The only thing do quick marry. Why?
I think most people take decisions very lightly. Career wise, education wise, even when I was choosing, I decided to become a doctor not after finishing secondary school. I knew from JS1 or JS2 that I wanted to be a doctor. I knew the reason why I wanted to be a doctor. And I think people should be more meticulous in taking decisions. There is no competition with anybody. I don't think you need to compete with people on how far this person goes, and you only set the goals for yourself, and you meet up a standard. And for me, I put up a standard for myself, and if I don't, I always want to meet up to that standard. I don't want to succumb to the pressure of people. So, and I think that's the main reason why I took my time. I wanted to get what I want.
As a very fine boy, when I came to Constanta, the girls were flocking around you and you were not responding. And I asked you whether you were gay. Because fine boy like you, babes just they jump around you, they agree respond. They were even calling me. Then you made a profound statement. You said, Daddy, if I settle down for these ones that are immediately available, what if I see someone better in future? What will I do? And I held on to that your conviction and allowed you that you should not be in a hurry to eat unripe fruits. You might eventually they might eventually purge you in future. And I'm so glad that you eventually married the kind of person you wanted to marry.
Yeah,
Your wife is a German.
yeah, she is.
What does she do?
She's a government worker and also a lawyer. Works in the Ministry of Internal Affairs and also goes to court, and they regulate most organizations here in Germany.
Did you marry her so that you can get papers?
No, I had papers before I met her.
You had papers. You already had the German passport
Yeah,
before you met her.
yeah.
So it's not that you married so that you can stay here.
No, I don't. I don't believe in that.
You have always wanted to stay in Europe instead of America.
Yeah,
Why do you prefer Europe?
I think it's based on the culture of the people. culture of the people in Europe in comparison to America. Everybody has their own
Prep.
preference.
Yeah.
I don't. I think my what I saw, what I wanted to achieve in life, um, was better suited for Europe than America. America is nice. I'm not saying that America is not bad. There are so many Nigerians that are succeeding in America, but I think everybody's vision. My vision might not work in China. Somebody else's vision might work in China, but for me, it was. I
Like
think
as my vision is working in Nigeria.
yeah. So I think my vision was good for Europe, and I didn't really see myself in America. That's why that
It
was
is it is instructive to know that you contributed to the reason why your two brothers went to America.
yeah,
You introduced them to the work and travel.
yeah.
Okay. Now let me ask you one question. Through you, all your two brothers have come here. Why did you take that play that role?
I think it's the fact that I came to Europe and started schooling here.
Sorry, before the call came in, yeah, I was asking you that your younger ones, you made sure that your younger ones subsequently came to Europe, two of them, your two brothers. Why did you do that?
I wanted to give them the same opportunities that I had. Um, from coming to Europe, I saw a different aspect of education, of life, of what I can achieve, and I wanted to also give them the opportunity. I think one thing for me, I think it's a duty that I should be able to open my siblings to the same opportunity. I don't think it should. The reason I came is just for myself, but like I said, at least to allow them to also experience what I experienced.
And you settled them in Romania before you came to Germany.
Yeah.
You've always been a good leader. I'm not afraid about life that I have somebody like you. Now, um, we have a lot of businesses that we have established in Nigeria,
Mhm.
and you are living in Europe here. What happens to these things that we have established?
In terms of managerial ability of managing the businesses that we have in Nigeria and also here, I think for me, I'm also interested in managing them. I think a country should not limit your opportunities. I've always thought on a global level. I don't think I'm a citizen of Nigeria, but I also think on a global level of I want to be able to. I believe in the ability to be able to expand into the world, and I would I would really love to have businesses all over the
So
world.
you intend to globalize
I intend to globalize.
what we have set
Yeah,
up,
that's one of the reasons why.
and I think that gives me joy. Um, I want to ask you a question.
Yeah.
How do people react? Two people were discussing behind you about immigrants.
Yeah.
What did you tell them?
I was sitting down. I think it was in a restaurant or so, and mm, you have a little bit. You have some people who are not very friendly with the ideas of immigrants, and they were saying that the government is trying to bring immigrants and more immigrants, and most of them don't pay taxes. And they kept talking and talking, and it started getting me angry. And I turned to them. I told them that I pay more taxes than two of you, and
Two of them joined together.
joined together. I pay more taxes than them, and they asked me what do I do, and I told them, and no, we are very sorry. I said that's the truth. The fact that you see me as an African does not really mean that you earn more than me. And I think that's one mentality that Africans need to change. Um, Everywhere I go to work in, I try and change the mentality that they have of Africans. We should not always come with the sense of we are subservient to someone else. And I try and change this mentality. So that's why I replied them.
And what they shut up their mouth.
They were very, oh no, they were very surprised, and first of all, they didn't believe it, and no, they said no, they don't mean me, and I said that, but that's the truth. There are so many other Africans that really do well, but I think we should try and change the narrative of how people take us. Yeah, that's one.
Okay. Now, what's the life we are living now? You talked about global,
Yeah,
and I had always wanted to have grandchildren. We just came from your in-laws' place,
yeah,
your German in-laws, and any of my grandchildren born in Europe, I give them $1,000.
yeah.
I've sent your own to you, no be so?
You have sent my,
Eh?
you have sent my own.
When the child is 18, we must create this narrative that when people see us, our color should not be seen as a disadvantage. Rather, it should be a protection against the ultraviolet rays of the sun because we are close to the equator. I was in Otopina Airport, and I was talking to one white young man. Otopina is in Bucharest. And I told him, my friend, he asked me, have you heard about Charles Darwin? I asked him, have you heard of Lamarckism? And he didn't know. Have you heard of dematerialization and rematerialization? He didn't know. Then I told him that, look, your skin is whiter than my skin, but my brain is whiter than your brain. So don't mess up around me. And you do a lot of surgeries.
Yeah,
You do hip replacement surgeries.
yeah.
Which other surgeries do you do?
Surgeries on the spine, surgeries on the.
Oh, you do surgeries on the spine.
Yeah, we do surgeries on spine when with patients that have fractures of on spine, surgeries on the arm, lower limbs, upper limbs. I've done a little bit of visceral surgery too and vascular surgery.
Oh, you up vascular surgery.
Yeah.
You anastomose blood vessels.
Yeah, we rotate. I have rotated in those departments.
Okay, so when there's something that is fascinating me. Do the patients know that it's a Nigerian that is going to operate on them?
Sometimes no. Most of the times, I come after the operation, depending on the kind of case. If it's sometimes I come before the operation if I'm able to see the patient before the operation, and I talk to the patient. And I think, first of all, they don't believe it, and when you start talking and they see that okay, you know what you're saying, then there's kind of an admiration and respect that they have for you.
Have they ever asked you how you became a doctor so young?
Yeah, some of them have asked me.
So what do you tell them?
I told them I went to study here and this and that, and sometimes they ask me where are my parents, and I think sometimes when I see my father is a doctor, and they kind of relate. Okay, yeah, he comes from an educated family.
So you don't think that education is a scam?
I don't think education is a scam. Depends on what you use with education. Education is a tool that builds you up. You can be very intelligent, you can go to school and yet not succeed. I think education just builds the qualities that you have and makes it possible for you to be able to express these qualities or use them in the open world or in business world.
Okay, do you have the intention to go into business like your father?
Yeah, I'm actually doing one or two things.
This boy, you don't follow your papa line. Now, are there things that you heard me do or say, prayers that we prayed at home, declarations that we made that have influenced your life?
Yeah, we had when we're young, we prayed for most of these things, going out, education, having schooling abroad, money, visiting countries, and
Multiple visa come,
multiple visa, and
money come,
yeah,
big
and
invitations come.
yeah, and most of them came to pass. I believe the power of life and death is in your tongue. What you proclaim comes to pass in your life. So
I've asked you this question before, and just for the sake of our viewers meeting you for the very first time, Is there any particular incident? I used to take you into the hospital.
Mm.
Is there any particular incidents you saw in the hospital that made you to decide that you will be a medical doctor?
Uh, I remember one incident. I can't remember how old I was. It was in the hospital in Ogbo Hill. We had a patient. They had this place where they reared cattle,
They slaughter
slaughter
by the
cattle.
waterside.
Yeah, and there was a patient that had a gushing wound on the thigh,
Yes.
and you were sewing it, and you told me that I should come in, and I think I had to stand on a stool or
To
so
see what I'm
to
doing.
see. That's
That was the lasting impression.
yeah, that's right.
I used to write professor on your hand.
Yeah.
And then that particular boy, they wanted to slaughter a cow, and he was holding the horns of the cow. Then the cow shifted the horns from his hand, and the horn tore through the inguinal ligament, entered into his abdomen, and I went in. I cleaned the wound because it was on the right hand side. I just removed the appendix at the same time, cleaned the wound, then put a drain because it was so dirty, and it eventually healed. I dressed it for some weeks, and it eventually healed. And I thank God that that left a lasting impression. Today, you are a better doctor than I am. I operated on black people. Today, you are operating on Europeans, and I practice as a general practitioner. But today, you are a specialist. Now, what do you think is the future of our country?
In terms of medicine, I'll start from there. Um, I think we can achieve what these people have. There's nothing very, very difficult in what they do. The problem is the will to order, and being able to, first of all, the will and order. Our medical system in Nigeria, if we want to change it, we'll be able to change it. That's the truth about the matter. If we decide to put in the reasonable resources and the reasonable changes, we'll be far better than them. And we also need a system of order in our medical system. There is no real order in the medical system, and that's what makes these people function, or make this system here function. There are so many rules upon rules and upon rules and upon rules. And when you come here the first time and you start practicing here, you see that the reason why I operate on patients that are 98 years old and they survive. And that's because of there are always checks and balances. There are so many checks and balances. Someone who is 98 years old, he has a doctor who checks him up. He has this checkup, And I think those things we don't really have in Nigeria. So we have to put in this order, and I think we'll be able to achieve what they have here.
And still less of our money.
And still less of our money.
Like Germany here, they don't go to war.
No.
They devote their money to managing their economy.
Yeah.
They say Germans obey rules.
There are so many rules here in Germany.
Rules.
There are so many rules here.
Tell me that story of can you drive with your driver's license?
I was watching a comedian from America. I can't remember his name, and he said he was talking to a German and asked the German, "Is it possible to drive in Germany without a license?" And the German said, "No, it is impossible to drive." No, he said, "But what if you drive without a license?" No, he said it is impossible to drive without a license.
So it is impossible to break the rules.
Yeah, it's impossible to break the rules, and I think that's what makes a society function. There must be checks and balances. If not, it's like living in a jungle.
Like living in a jungle. Finally, coming, have I disrupted your plans?
No.
I'm always scared of coming to disrupt your plans, because you guys work so hard for your money, I always try not to be a burden on you, though you've taken very good care of me. You've put me in this hotel. You've bought stuff for me. And I'm very proud of you as a father. I want to build a specialist hospital. Do you think it's possible?
It's possible. It's possible.
Do you think we should do it?
Yeah, I think we should do it.
Because your younger brother's wife is a cardiologist.
Yeah.
You are a surgeon.
Yeah.
And I'm a doctor. Your mom is a nurse. And I believe that we can. Edafe is there. Edafe is an orthopedic surgeon.
Yeah,
His wife is
she's general
practitioner. You took me to go see one of your friends.
He's a cardiologist.
He's a cardiologist. And you have a lot of friends here who are surgeons and all kinds of practitioners.
Yeah.
If we build the hospital and equip it, personnel will not be a problem.
Yeah.
You just take a vacation.
Yeah.
You come stay with us for 1 month, do all the surgeries, and then you guys can go back or you leave them for the Nigerian doctors, transfer skills so that I can put back into society the medicine I didn't practice for long. Thank you so much. I always travel without your mother. You want her to come and visit you?
Yeah.
Why does your mother not travel?
She does not like flying.
She does not like flying. We're going to drug her one day, put her in the plane like Umaru Diko before she will wake up. She's in Germany. So I want to thank you, Dr. Mimi Apoki, and I remain your friend, Dr. Charles
Apoki.
God bless you, sir.